I was leaving a regular CEO job and coming here and doing and attracting professionals. And today I have 16,000 employees to run this. And my reviews here are much more severe than what I did there in my regular corporate life, because here life is in question. So one is the number 108, and second is we must have a center, the emergency response center. And now please remember this number. You need not dial prefix, suffix, nothing of the kind. Wherever you are in the state. Today we get 40,000 calls in Andhra. Like that, all the states together, I get today close to 200,000 calls I get in these centers. I have only one center, emergency response center for every state. Whereas in America, every 50,000 population there is one center. 6,500 centers in America to cover 30 crores people. Today, we are covering 40 crores people with only 10 centers. I can do it one actually. Technologically it is possible because state health is a state subject and every CM wants to have his center. So it's politically it's correct to have one, plus language barriers, all that kind of things. Emergency response center, we built something you must go and see. We thought Andhra we have built something fantastic. Recently, Mr. Modi has inaugurated in Gujarat on July 1st. Fabulous place in a 15-acre campus, more than 80,000 square feet we built. The center has to be 20 feet height. It cannot be, this cannot be suitable for a emergency center, this room. People have to breathe, they need space, they need air, they need light. That kind of design what we made in Gujarat was recently inaugurated. The first one was being Andhra, inaugurated 5 years back. Like that, every place where we built even temporary facility, the center is something where employees have to get de-stressed to take this kind of 200,000 calls every day. Because they keep hearing blood and loss and crying and this and that. That time, the employee who is taking the call has to get de-stressed out. The ambience has to be like that. Space has to be like that. Not regular BPOs of 25 square feet, 10 square feet, 12 square feet will not help. This design is, I have 10,000 square feet for only 65 people to sit down. That is the kind of ambience you have to create if they have to save a life. Third one is, you need an ambulance. Now you need an ambulance. Now what is ambulance? Now this is a question when asked, everybody said, who is your customer for ambulance? Everybody said patient. Patient is not my customer. Unfortunately, he doesn't buy this product on his own. Somebody else buys for him. And he is forced to get into them. He doesn't even know sometimes he got into an ambulance. Also he is unconscious. Now who gives me customer satisfaction survey, feedback, all that kind of things? It is relatives. It is relatives who accompany. In our country particularly, 3-4 relatives fight with the patient sometimes to get in first. I have to, because their affection, their care for the patient is so much, they want to get in first. Now I have to ensure they are safe, there are seat belts, there is a 3-4 people sitting place there, their seat belts, they have a pen there, they have mineral water to drink there. See that they are comfortable so that they are shut up and I can take care of the patient next now. If they are not shut up, then you can't take care. They keep on asking questions. Now the next one is, the ambulance is not meant for relatives. It's not only relative, not only patient, but public safety. I don't have a right to kill 2 people on the road while taking this patient. So the braking system, the design, the lights, the sirens, the sounds have to be different to ensure that you are going safely. And it has to answer not the American emergencies. Our snake bites. In America, when I went in 2005 to study 911, pregnancy is not emergency in that country. For me here, 35% of the emergencies are pregnancy related. And we even said any pregnant woman ringing up 108, don't ask any more questions, just take. Anybody above 60 asking for 108, don't take. Anybody under 5, take. No questions asked. Because our country different healthcare priorities compared to them. We want to reduce IMR, MMR and increase institutional deliveries. Now this has to take care ambulance 42 kinds of emergencies. And we have 42 kinds of emergencies to be handled in ambulance. Now nobody tells me this is not a product where you book in advance. He comes automatically. So I have to prepare that equipment, that medication, that skill, all have to be there together to take care of that snake bite victim at 9 o'clock, and then 10 o'clock I may have to deal with the pregnancy, and at 11 o'clock I may have to deal with the cardiac. Do you have those equipments? Is the guy skilled there enough to travel, take care of the patient? Next one is the GIS maps, GPS, to know exactly where is your house, where you are, where it's happening. I can sit in Hyderabad and locate all my 18 ambulances in Goa, where this ambulance is, why it is waiting, is it for a signal, or the guy has dropped a patient, or which patient is inside, I can monitor sitting here. That is the technology what we call the AVLT, automatic vehicle location tracking equipment. And my wife said it is fantastic, I want to buy one. She thought it is automatic Venkat location tracking. Now the next one, most important thing is the people. Now this country doesn't have, when you use the word paramedics here, it is anybody other than a doctor is called a paramedic. Anybody who is not a doctor is called a paramedic. Whereas in US when you call a paramedic, it is highest profession. Sometimes they are preferred to a doctor in emergencies. Now here, getting somebody, I didn't have any resource. So I have to train BSc graduates, take them fresh, train them for 2 months, call them for a refresher, and teach them from anatomy a little bit. Then we don't teach them how to treat. They are not responsible for diagnosis. They are only to stabilize a patient. That's all, whether airway is there, breathing is there, circulation. In each of the chief complaints, what needs to be done in ambulance is what we teach them. And then a driver. Now we said this word driver, if I call, I said no use. We said we'll change the word and call it a pilot. And I asked them, why am I calling you a pilot? He said, sir, pilot, I cannot accept tips, sir. As a driver, I can accept tips. And number two, as a pilot, I have to be a team worker. Whereas a driver, I can drive solo, no problem. And number three, sir, many times, driver can drink and drive. Pilot cannot afford to do that. And remember, this distinction came from a driver of 10th class educated to tell me how happy he is. He is proud to be called. Today I have more than 8,000 of these people who are only 10th and 12th who drive the vehicles. I must tell you with all humility that lesser the education, people tend to be more innovative, more team working, and they are willing to learn new things. I'm sorry to say though, I'm also so-called, today the literate, his definition changed. Literate is the one who we were told how he reads and speaks, that's all, how much he can read. But today, in 2010, the illiterate is the one who doesn't learn, who doesn't unlearn, who doesn't relearn. I'm sure I'm in that category, some of you must be in that category. Because the amount of time, the fact that you have spent time to attend the conference itself indicates that you want to be literate to learn something new, what's happening. Now, this is the infrastructure, a number, 108, emergency response center. Then I have GIS, GPS maps. Then I have the ambulance. Then I have the trained people. These are the 5 with this infrastructure. Then I said, what are the 3 major components of this program? One is the process. Now, what is this process? The process is, you ring up 108, it lands at the center. It lands at the center. Now, who has to take this call in 75 people? Which one has to take? Who is free? All this not will switch to something else to various servers popping up the data, saying which is the nearest hospital, nearest ambulance, nearest police station. All this data has to come to make a decision. In 3 minutes time, that ambulance located in Srikakulam, which is 700 kilometers from here, that ambulance has to move. In the meanwhile, this patient who rang up here, after collecting basic information, who you are, what you are, the screen with the voice gets transferred to the next dispatcher in 30 seconds. He finds out nearest ambulance, nearest police station, then he connects the caller, he connects the call to the EMT, the paramedic there in Srikakulam. And both of them talk to each other, and he says, no, I need a doctor's advice, there is an emergency response center physician in the center. Now the screen goes to the physician. Then they say, oh, no, it's a suicidal attempt. A police vehicle also is required. The police sitting in the center gets the screen. The same screen gets transferred to police or a doctor or the dispatcher, and then the vehicle moves from there, starts talking to the patient before the ambulance goes. In 20 minutes time, in 15 minutes is urban average, 20-21 minutes is rural average, tribal average is around 28 minutes is the time what we have taken to reach in the same India, same traffic conditions, same bad roads,